administrators in these post-acute spaces need to be very creative, not just with how they're attracting people and what the culture looks like, but they've got to be creative relative to communication. We all know communication in healthcare is ostensibly broken. And so what are some of the biggest challenges that you're seeing in these facilities regarding communication?
Sure. I mean, the reality is long-term care as a whole has been extremely behind in software and technology. I mean, there's still facilities that do paper charting, which is, I mean, just to me in 2022, outrageous, but it's expensive and it's new and it can be kind of scary to adapt these new things. But we're slowly starting to see lots of really great products and services out there to help aid long-term care, whether it is charting or with anything to do with AI and helping residents and falling, or with therapy, or with not charting, excuse me, scheduling. You know, there's some scheduling software out there. I mean, just the reality is that they're so far behind. We have to play catch up and we have to get better with communication. You've got so many different health systems and so many different companies that have, you know, your patient chart. I think of all the different hospitals and clinics and doctors' offices that I've been to, and they don't talk to each other. They don't know what medications I'm on at one facility versus another. And if you've got a resident who has been in and out of hospitals for years, has comorbidities, and is ill, and is then coming into these facilities, and you've got a new doctor now that's trying to understand the history of this patient, but there's no communication and understanding of their chart or their history, that can be really, really difficult. And then that leads into when they're in the facility, the communication there with families, with staff. I mean, that can also be another barrier. Not all family members live right down the road from the facility, or have family members that can come in. Not all have phones to FaceTime or, utilize new technology. So I think, communication is definitely still a barrier. I think it's gotten better during the pandemic. In Utah, we were able to get some funding to help with telehealth and with talking to families. So all the facilities could get iPads and tablets to be able to do that. So I think, the pandemic, as terrible as it was, it caused some good growth forward.
But it pushed technology.
Yes, it definitely, we had,
sure.
I mean, we really had to. If you think about a lot of the things that came from it, we had to be innovative. We had to start using these things. So I think, there was a benefit to that. And I think we'll continue to grow and get better. But we're definitely, I think, behind the times in a lot of those things.